Hello, welcome everyone. It's my pleasure to welcome you to this white coat ceremony. They can't hear me? Yes? Okay. Well, once again, welcome to everyone here, to students, families, and invited guests. It's my honor and pleasure to welcome you here. You have chosen to come to school, which, despite its tradition of 3 centuries, is always at the front of innovation. In case you wanted to know what our vision and what our principles that are guiding us, those include humanistic environment, delivery of high-quality evidence-based patient care, shaping global dental profession, promotion of interdisciplinary collaboration, and scientific discovery and mentoring exceptional leaders. I'm sure you walked around the campus, and those of you who visited other dental schools realize that we are very unique because all 12 schools are in one unified campus. And this is really a great strength. Our unique campus enables us to closely collaborate in teaching, research, and community outreach in ways which are unimaginable in other schools. Our students and faculty work together with schools of medicine, law, engineering and applied science, Wharton School of Business, veterinary medicine, nursing, as well as the School of Social Policy and Practice. In addition to obtaining superb education, the opportunities to enrich your education via selective courses, enrolling in senior honors programs, obtaining dual degrees with our sister schools, attending hospital-based externships, engaging in research activities, and community-based programs are second to none. We all realize that you, the past students, had to overcome incredible challenges and obstacles by immigrating to a new country, adapting to a new culture, and above all, having to return to dental school once again. We therefore admire your determination, discipline, and personal and financial sacrifices you had to make to get to this point. I speak on the behalf of the entire PDM family in assuring you of our dedication and commitment to make you proud of your decision to attend Penn Dental. We wish you all the success. Thank you. And it's now my great pleasure to introduce our Morton Amsterdam Dean, Dr. Mark Wolf. Thank you. Nope.
So for those that have been here before, they know that the question is only when. I will get teary, not if. You can take bets on whether it's in the first or the 20th minute. That being said, welcome to the friends, the family, faculty, staff, students, and most important, the Penn Dental Medicine class of 2026. It's really great to have you here. We're gathering today to celebrate a white coat ceremony for this class. It's actually something that was introduced 2 years ago when the class that starts in January, I told you I won't use that 4-letter word that goes before it. The class came to us and said, well, why don't we get to do the white coat ceremony? And never failing to hold an event whenever possible, we now have a white coat ceremony for that 4-letter word group of students that will graduate in 2026, never to be referred to again by that particular terminology. You come here from 12 different countries, 13 depending upon how you count, 14 depending, never mind. I visited 7 of these countries for a bunch of different reasons. 5 of them I actually spent time lecturing in the dental schools, which was absolutely wonderful. Even more wonderful, in 3 of the countries I spent time underwater on the reefs, and they were wonderful. That's really quite remarkable. And I spent a good deal of time with individuals and groups actually in the country, looking at the cultures and the people, and all good things. For those countries that were not on my list, I don't want you to feel excluded. I'll try and get the other 5 in before I stop traveling. They're beautiful, but you know, you come with so many cultural distinctions and differences as part of what makes you the individuals you are today. You speak multiple languages, and you came here all unified in one pursuit, and that's getting the best dental education possible. And as I promised you this morning, we will see to it that you get the best education available in the world today. You each look at this university and this world through a unique lens. It's the lens which you grew up with, the people that raised you, the environment that you were in for the vast majority of your life. You come here to be trained as a healthcare professional, and it's an incredible commitment that you're making. You know, you went through whatever process was there in the countries of your origin, and you completed it successfully, and then emigrated to a new country with new cultures and new housing and new ways to figure out how to pay the bills. And you come here to participate for another 2.5 years in your education. That's an incredible commitment, and I laud every single one of you for making that commitment. You know, you come, as I said, from different countries, and the way you were taught to practice in those countries will be very different from the country that you've come to learn here. Penn Dental Medicine will teach you all about the American health system, and it's important for you to recognize that we're not going to sugarcoat a whole lot. America ranks #1 in the per capita expenditures on health, yet number 45 in life expectancy. Japan spends 1/2 that amount, and people live 5 years longer. Spain spends 1/3 that amount, and they live 4 years longer, and they get to take afternoon naps, which naps aren't a bad thing to have part of your culture. Let's look at some examples of a healthcare system and a social system that's somewhat different. So 4 years ago, we were January of 2020, and what was amazing is we were hearing stories about a respiratory disease coming out of Hunan, China. We didn't know a whole lot about it. We weren't getting very clear information about it. By the way, I had been in Hunan, China on December 7th, not Hunan, Wuhan, I'm sorry, Wuhan, on December 7th at their dental school. It was nice to hear a little bit about this disease, and we became good friends with the dean from Wuhan, and he was helpful actually in getting Penn Dental Medicine through what would become a pandemic. We had no way of recognizing where the world was going from that moment. In America, that's not crying yet. In America, 1.2 million people died of COVID. And that's not even a full report because many of our states independently refuse to report data on the subject. We represent, 7 million people died globally, and that's probably also an underestimation because many areas didn't have great health systems to report. But in the United States, we represent less than 5% of the world's population, yet had nearly 20% of the world's deaths. It's kind of a remarkable item, especially when you realize you're sitting here at the University of Pennsylvania. 3 years ago, literally this month, we were online to get the first of what would be multiple vaccinations using a new system called mRNA. Everybody knows about mRNA vaccines. I hope you know that they were invented here on the Penn campus. And the two inventors who were Penn faculty at the time have received the Nobel Prize for this. What a change. It reduced, worldwide, it reduced the number of deaths, the number of serious hospitalizations, the number of serious illnesses. And that was an incredible outcome. Yet America, which had more vaccine than it could physically use, still had a worse outcome of this disease than virtually any country in the world. And I'll carve out China, which did not report really well. But we have to look at why we had this, and it will come directly to you as a healthcare professional. We face a pandemic worse than COVID. This is a pandemic that we just didn't understand what we needed to do. And you and I and our profession together needs to do something very differently going forward. So what was that pandemic? Today it's recognized as a political polarization, a social media issue where information is made available in different contexts. We live in a world of news feeds where there are multiple truths to every issue, at least on the news feed is what we're being told. There's a tremendous science disinformation. We had people in our own institution asking questions about the ability to track you through microbots in the vaccine. The fact that when you take the vaccine, you become magnetic and spoons will stick to your forehead. People taking the vaccine and dying. And we allowed this disinformation to promulgate, to sit out there, to be discussed almost the same way as Fauci talking about the science that was known at that moment about the disease. But what was the effect of that? Today in America, we have fewer people receiving highly effective booster shots for diseases like the measles, mumps, and polio. Yes, in the United States, we have the first cases of polio that have been seen in decades because people are refusing to take a vaccine because of disinformation, that we allow false statements to carry the same weight as the facts. We saw a significant narrative in social media that blamed Asians for creating and bringing this disease intentionally to our shores. It created distrust. We had dental students in this school who were harassed and assaulted because they were Asian. Because somebody allowed a discussion saying the Kung flu and disease was the fault of an ethnicity or nationality. We allowed a creation of a distrust, a hatred, a harassment of the Asian community, and that was just one example of what we allowed to take place. We allowed a distrust in science. We, as consumers of science, as a profession, failed to stand up every time it was uttered and say, no, this is not true. You don't get to make up these stories. They are not founded in science. They are not true. You cannot allow this to promulgate. No matter what, you cannot allow a hatred to promulgate against an ethnicity or a race based upon, even if it was transmitted from another shore. You cannot have race-based or ethnicity-based hatred. We, as part of a healthcare system, failed to be effective representatives of the science. We, as professionals, have failed to be the skilled and trusted public health communicators that were necessary. People sit down in our chair, let us do crazy things in their mouth. We have to actually have a voice that talks about something else. We as professionals fail to protect everyone in our society and speak out against the isolation and hatred of any ethnicity or minority. Penn Dental Medicine is a historic school created in 1878 here at University of Pennsylvania with the faculty from a school that existed nearly 40 years earlier. It was made possible in part from a donation by Thomas Evans. Our current school, that coach you see sitting in the front was Thomas Evans. He gave the money to build the original school that was constructed in 1915. You want to talk about leaving money, he left the university $5.7 million in 1897 when he died. That was when $5.7 million was real money. It's formed the legacy that you're now joining. He charged the University of Pennsylvania with creating a school that would be second to none. Penn Dental Medicine has become just that type of school, second to none. Throughout our history, we've welcomed women into what was an all-male profession. We have welcomed people of color, of all races and religions and sexual orientation, even when that was not popular. And we didn't always do it in the nicest of ways, but we always welcomed these individuals. We have led the way in so many different areas of social justice, as well as scientific innovation, and we'll talk about scientific innovation in the future. The Evans Building opened in 1915, just as the Spanish flu epidemic was going to take nearly 1 million lives in the United States. By the way, the science of that day cured it with cucumber sandwiches and shots of whiskey. Not exactly effective in preventing the flu, but enough whiskey and at least it didn't bother you. The science was very poor then on both how to prevent and how to treat the disease. You're here to become students of science, consumers of science, experts in the public's health. Today we must become unwavering advocates for patients, for the patient, for the health and well-being, no matter what our political position is. Science is not perfect. It utilizes the best evidence of the moment. And tomorrow, a new scientific piece of research can come out that changes the way we think. We must be creative enough in our own mind to be able to consume this information and express it properly to our patients so they can understand why is there a change. First it was don't mask, then it was mask, then you had to mask, then you had to separate, then you don't have to separate. You have to be able to read and understand why and help translate this for a generation that does not have that skill. It requires the best of you. You must become an advocate for the public's health, not necessarily our own best well-being as practitioners. We have to put somebody ahead of ourselves. So we do have methods of reducing the risk from COVID-19, preventing polio and other life-threatening diseases. We have to figure out how to communicate that as a public. This is a white coat ceremony, and I'll head to the white coat part of it now, and why white coat is a significant item in this journey. During the first days in the profession, you're getting this white coat, and you really have only the foggiest idea what's expected of you as a professional. We'll go over some of it right now. I was never a really big fan of white coat ceremonies early in education. I thought you had to kind of earn a little bit. I was wrong. what I learned is it's important to understand the obligation of wearing the white coat, doing that early and right away. Today, the profession requires more than being able to speak about Mr. Cavity. It's about being capable, not that you won't be tested on that later on. I don't know what the test questions will have on it. You must be capable of respectfully working in a community, even with people you do not agree with. It includes looking out for racial, ethnic, and religious minorities and underserved wherever they may be, even if they're not your immediate patient. We have to care about a society at large. The white coat ceremony is a ritual where you, the new student, accepts the responsibilities of being a professional. It's a 24-hour, 365-day-a-year responsibility. You're responsible for behaving as an ethical professional 24/7 all the time. There is no separating your personal and professional lives. Your personal public social media, and I'll call that out right now, represents you. And if you tie yourself to being a student at Penn Dental Medicine, which I'm sure you already have, anybody not? Yeah, I kind of figured. You are a member of Penn Dental Medicine. That means what you say and what you do reflects directly on Penn Dental Medicine and Thomas Evans and the nearly 175 years of this school that's gone before you. Health providers did not always wear this white coat. Health providers in the 1800s actually wore black coats. Do you know why? Of course you do. Everybody knows black. It covers up the dirt better, exactly. It wasn't until Lister showed up and talked about cleanliness that it became important to come to your patient looking clean and white. The coat, that is, not necessarily the color of our skin. Yeah, that's okay. I'm used to students not listening. I'm used to listen, never mind, I don't listen to students cry. There's no crying in the dean's office. He's the only one that's allowed to shed a tear. They even wore these strange black masks to ward off evil spirits. That was the science of the day. We've come a long way, and we started wearing white coats as a process of showing the cleanliness, and then the white coat came to mean something. I very rarely shout out another university, especially another competitor. The white coat ceremony came out in the early 1990s, secondary to a medical school ceremony at the University of Columbia University. They were the first of the American universities to do a white coat, and white coat ceremonies are now being adopted worldwide as a method of bringing somebody into the profession. It symbolizes something, but the question is, what does it actually symbolize? It isn't about what it makes you feel like, though we put it on and you instantly think you're smarter, and you put it on and you actually think you can get dinner reservations and things like that. It doesn't quite work in all of those cases. You'll need to study, and reservations, forget it, they're still hard to get. It means something to the patient whether or not you're wearing it. Wearing a white coat says more to a patient than you follow infection control that Lister demanded. Patients associate you with being more. They know that you're smart. We know that you're smart. You got into Penn Dental Medicine. You couldn't have done that unless you were. But they also believe that you are a scientist, a consumer of science, somebody that is educated in the best ways to treat them. Wearing the white coat says to the public that you'll spend a lifetime learning and staying current. I'm sorry, graduation in May of 2026 is not the end. It's the beginning of a much harder learning path for you. There won't be a classroom or a faculty member to help teach you. You will never be allowed to stop learning. You have to keep that sense of curiosity and learning at all times. It says that you're a Penn doctor even when you're not wearing the coat. The public will always see you as a doctor, and you will have to help them whenever. It means that you'll do whatever is necessary to protect the public, even when you're not in school, and even when it means making some sacrifice to the things that we would ordinarily want to do ourselves. It says to the public that you care about your community and the healthcare system. You know, and why do we even say that? The fact that you can charge something to a patient that they don't know about, it's our professionalism that prevents us from doing that. We only charge for the things that we've actually done. We charge respectfully based upon what we have done, based upon what we charge others. We treat all people with some equity and equality. It means that you have an honesty and an integrity in every aspect of what you do, and that you apply what's best for the patient, not necessarily what's best for you personally. You provide compassionate treatment, and you provide respect and dignity to every person, no matter who the patient is. Wearing the white coat has a tremendous obligation, and the oath you take today comes with some awesome expectations. The faculty that are here will place this white coat on you because they believe that you will be able to live up to those expectations. They expect you to. They know what it means to be a practitioner and to fulfill these obligations. It's much more than fabric, and it's everything that we expect a Penn graduate to do. So, I welcome you to what is a very elite club of people that will be able to call themselves Penn alumni. I cannot. I did not graduate here. But you will be able to. Welcome.
Thank you, Dean Wolf. So now some housekeeping items. It's time to introduce and formally welcome the past class 2026 members. What we'll ask you to do, come in alphabetical order, and each student will tell their name and their country of origin. You will then be clocked by the faculty member on stage. So I'd like to introduce the three faculty members who will be working with you in the preclinical laboratory. Our Dr. Karina Harrington-Gross, Dr. Josephine Chang, and Dr. Leah Kasulakis. They will be cloaking you. Each student, please proceed to the center stage. Thank you. And a photograph will be taken with the dean, and you will be able to download this photograph. So if you miss your selfie, do not worry. Those photographs will be delivered to you. So welcome, and let's proceed with the white coat ceremony now.
Pooja Aluwalia, India. Hello?
Hold on.
Oh, it doesn't go into the.
Not only will you speak to that one, but you'll hold this one in your hand and speak to that one.
Okay.
And then it'll be passed to the next person.
All right.
That's
So-
what a dean does, solves a problem.
Okay. Pooja Aluwalia, India.
Franz, make sure that's on.
Is it on?
I
I'm
don't
just gonna
hear
have
it.
them project.
Yeah.
Come on over, get your hands shaking. Is your hair fluffed the way you want it to be? There you go.
Wajiha Aftab, Pakistan.
I'm grateful for having you. Then you straighten out the collar and stuff. Yes. Yep. There you go. Now, there we go. That's
Simra Ajmal, Pakistan.
Get that hair fluffed. I have to fix the collar. You're not
Amir Hassam Amini, Iran.
Oludare Ayodele, Nigeria.
Yeah, I'll help with you. Yeah.
Mohammed Badran, Syria.
Anusha Bhatta, Nepal.
Anisha Chaudhary,
But I know your hair's not fluffed the way you want.
India.
Samreed Gill, India.
There you go.
Monica Gurung, Nepal.
Jihad Hassan, Egypt.
Now, come on down, tackle her, get her over here for a picture. Nepal? No screwdriver in Nepal, that's for sure. Perfect.
Thinzar Soitat, Myanmar.
Herleen Kaur, India. Tina Nani, Egypt.
Bruktawi Tunde, Ethiopia.
Radhika Kacharia from India.
You're doing great, Leah.
Amandeep Kala, India.
Afroz Khan from Pakistan.
Good evening. My name is Maria Fernanda Leal, and I'm from Venezuela. My name is Kimberly Ledesma. I'm from Ecuador.
Good evening. Soni Maharzan from Nepal.
Good evening. My name is Mina Migali. I'm from Egypt.
Good evening. I'm Puneet Nanda from India.
My name is Angela Rice. I'm from Venezuela.
Parth Patel, I'm from India.
Shilpa Patnaikuni, India.
Malavika Ramesh from India.
Karishma Amir Ali Ratani from India.
Arjun Sandhu, Toronto, Canada.
Over here. I have to get my picture.
Jill Shah, India. Snehal Sheladia from India.
Namrata Shaitat from India. Thank you.
Manali Sataria, India.
Ubay Taqi-Din, Syria.
Srishti Thapa, Nepal.
Okay, I will now invite my colleague, Dr. Harton Gross, to podium lead the PASS class of 2026 in the professional pledge.
The PASS class of 2026 will now recite the professional pledge found in your program. In presence of your family, friends, and peers, they will publicly, please rise. In the presence of you, your family, friends, and peers, we will publicly acknowledge the responsibilities of the profession and their willingness to assume the same. I ask that the PASS class of 2026 please rise and follow me in reciting the pledge. I will also like to invite any dentists in the audience who would like to renew your pledge as well. Please repeat each line after I have recited. The Penn Dental Medicine Professional Pledge. As I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations. I understand that my primary responsibility is my patients. To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty. Always placing the needs of my patients and community first above my own. I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession. I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession. I will conduct myself with integrity, treat my colleagues with respect, and wherever possible, work to advance the oral health of society. I shall faithfully observe the principles of ethics and codes of professionalism encountered during the dental training and beyond. I shall faithfully observe the principles of ethics and codes of professionalism encountered during the dental training and beyond. All these I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve. All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve. Please be seated. Congratulations.
So this basically concludes the formal part of the program. I'd like to invite all of you to join us for light refreshment upstairs. Welcome, class of 2026. We're delighted to have you here.